Well, aloha everyone, and welcome back to Anatomy 151 here at Chaminade University. Today we're going to be discussing the skeletal system, which is associated with Unit 7 and 8. We'll be discussing the axial skeleton, or Unit 7, today. So the human skeleton has 206 named bones that are grouped into two separate divisions. The axial skeleton, which we'll be covering today, is comprised of 80 bones, and the appendicular skeleton is comprised of 126 bones. Now, what's the difference, you might ask? Well, the axial skeleton includes the skull bones and the breast cage and all of the vertebrae. It also includes a hyoid bone, which is a free-floating bone in your throat, and your ribs, which are going to surround all of the internal organs of the breast area. The appendicular skeleton is basically going to be all of the long bones. So bones of the upper and lower limbs, so your extremities, right, your arms and your legs, and all of the bones that form the girdles that connect the limbs to the axial skeleton. So that includes, for example, your pelvic bones. All right, so these are the different types of bones that we can classify into 5 major types. We classify them based on shape. So the long bones are basically mean that they have a greater length than they do a width. Shorter bones are generally going to be cuboidal shaped, and flat bones are thin bones that are usually going to be parallel plates. We also have a ton of different irregular shaped bones that have a lot of complex shapes to them, and those are usually connective bones that are meant to articulate with other bones around them. And then sesamoid bones are bones that are shaped like a sesame seed. A good example of this would be your patella or your knee bone. It's pictured here. All right, so let's talk about the skull for a second. There are sutural bones, which are basically these small extra bone plates that are located within the sutures of cranial bones. So basically, wherever the bones are coming together, right? There are regions that are going to fill in, for example, the soft spot, right? So sutural bones. And anytime that you see the bones coming together in like these wild little lines, they're basically fusing together in what's called sutures. This is a sagittal suture, for example, and it's going to put together the two parietal bones. We also have the coronal suture that is here, and that's going to pair the two parietal bones with the frontal bone. And in the back, we have here the lambdoid suture, which is going to connect the occipital bone with the parietal bones. And then again, everywhere that we need to fill in, we're going to fill that in with what we call sutural bones. All right, so you may notice that all of the bones in the skull here are colored, and you may have heard me say previously that I do recommend an anatomy coloring book. You can get whichever brand you choose, but this really helped me when I was in school. You'll notice that all the bones have the same consistent colors throughout the lecture, and so that helps you to keep an eye on which bone is where as we start changing directionality. Another thing I want you to pay attention to here is the view, and you're going to, right now, you're looking directly down on the skull, right? So that's the view here, but you'll be able to know exactly what's happening in terms of where the whole skull is based on this view, which is meant to orient you in what direction you're looking at. So you'll see that that's going to change as we travel through these slides. Before we hop right into the bones themselves, let's talk about surface markings on the bones. So bones have specialized surface markings that are structural features that are adapted for specialized functions. That includes things like depressions and openings. These allow for the passage of soft tissues and allow for joints to articulate, so to connect two different bones together with something called a joint. Also, we have processes, which are projections or outgrowths, and these also are going to help create joints, and they serve as attachment points for ligaments and tendons. So these are going to be the skeletal muscles, or skeletal system is in connection with skeletal muscles, so that the objective of the entire skeletal system is to allow movement and motion of the body, right? And also, of course, for structure and support. All right, so what is a fissure? So a fissure is anywhere we have a narrow slit. So here's an orbital fissure, for example, and it allows the passage of blood vessels or nerves from one side of the bone to the other. And we're going to see several sets of fissures as we go through. Foramen just means hole, so foramen is a larger hole generally. One of the largest holes in the body is the foramen magnum, and this is where the spinal column is going to articulate directly in with the skull, allowing for a connective spinal tissue all the way into the brain. And again, the foramen is a hole just specifically for the passage of certain things like blood vessels, nerves, or ligaments, or in this case, for the attachment of the spinal column and for the spinal cord to go through. A fossa is anytime you see a shallow depression. So this is the mandibular fossa. So you can see this is the upper jawbone, right? The maxilla, and this is where the mandible is going to articulate in. So the mandibular fossa. It's a little depression, which generally are going to have the opposite of what's called a condyle. which would be like a little bulb that protrudes forward. We'll talk about that in a second. Sulcus is anytime we have a furrow on a bone, so like a little channel basically. And again, that's for passage of blood vessels, nerves, or tendons as well. We also have tube-like openings. This is a meatus here. This here is the auditory meatus, which is where our ears are going to connect. It's going to allow for sound to travel in, sound waves to travel in. But anytime you see the word meatus, it just means a tube-like opening into the other region, which in this case would be the inside of the skull. As I mentioned, a condyle is a process that's going to be projected out. Generally, it's rounded. Sometimes there's a region called an epicondyle, which is a little protrusion sticking off of that. But a condyle is a rounded projection that has a nice smooth surface on it. This here is a facet. So this is a vertebrae of your spinal column, right? Spinous process here. And this is a facet of the superior articular process. And basically what is going to happen here is we're going to have a condyle that's going to interact here from the vertebrae above or below. All right, here is the head would be a region that's a rounded articular process that's supported on a neck region. So this would be the head here, and this is the neck. These are rib bones, in case you're not familiar. And so anytime you see that you have a protrusion that sticks off of a neck region, it's called a head, which makes kind of sense. A crest is a prominent ridge. Here's a pretty classic example. This is the sacral crest. This is at the bottom of the spine, right? This is your coccyx. And so the sacral crest is going to be this region that's a prominent ridge that kind of protrudes. All right, as I mentioned, an epicondyle is a region of a condyle that projects outward. So an epicondyle would be a roughed region on a normally smooth projection of it, which would be like a condyle. And then here is a line. This is the nuchal line. If you reach back to the back of your skull, you can feel it. We have a superior and an inferior nuchal line. And it's basically just a ridge or border. It's going to be similar to a crest, but less prominent. We also have spinach process, so you can see here this is the spine, and the spinach process is a slender projection that sticks outward. And if you picture this as a vertebrae, they're going to be stacked on top of one another, and so this is going to keep from hyperextending. So it's going to help keep your spine kind of in line. It's also going to be a location where things are going to be attaching, obviously. So trochanter is a specific projection that's found only on the femur. It's the upper part of the femur region. We'll talk about that when we get to the appendicular skeleton. And a tubercle is a rounded projection that can be a variable size. It looks kind of like this. Okay, so that's an articular tubercle. And don't worry, I know that you're getting a lot of jargon right now, but you'll be using this as we start to discuss which bones articulate where and how. So tuberosity is a projection that has a nice, has a rough, bumpy surface. Here's a sacrum, and this is the sacral tuberosity. So it's going to be kind of a surface that's not as smooth as some other regions. Now we're going to start talking about the skull when we're talking about the axial skeleton. The skull has 22 bones, and that doesn't include the 3 inner ear ossicles. They're called ossicles, but they're the middle ear bones, and there's 3 in each ear, so there's actually 6 total. So if you were to add those on, there would be 28, but 22 just for the skull itself. And there's a lot of things that are associated with these bones, right? Different things like processes, ridges, depressions, lines, foramen, etc. So let's familiarize yourself with them. I know this is a lot. Don't worry. You're going to see these bones over and over for the rest of the lecture, just from different directions. All right, so we are face on the skull right here. This is the frontal bone. The frontal bone is connected by the coronal suture to the parietal bones. There's 1 and 2. All right, so if we're looking at the frontal bone has a couple different markings. The squama is here. This is your forehead, basically. There's also a supraorbital notch, right, and a supraorbital foramen. This is where we're going to have passage of blood vessels and nerves through into the eye cavity, for example. This little region here is the sphenoid bone, and it looks very tiny if you look here, but once we take a cross section, you'll see it goes through the inner skull. It's going to be part of the sinus cavities. Also to orient you, so everything that is capitalized is the bone, and everything that is in lowercase are different markings within the bone, all right? So if I'm talking about the frontal bone here, this frontal squama is going to be a marking of the bone, including, and another example would be the supraorbital notch, etc. All right, so what other bones? We talked about the sphenoid bone here. That also is going to be connecting with the ethmoid bone. Those are going to make your sinuses. So here's your ethmoid bone shown in here. Again, this is another one where it looks kind of small, but when we do a cross section, you'll see that it protrudes backwards into the skull cavity. The lacrimal bone here is going to be the cheekbone, right? I'm sorry, lacrimal bone is going to be where the tear duct is. I apologize. That's here. The zygomatic bone is the cheekbone. The lacrimal bone is going to be right in here. And again, it's also going to look small, but when you see the cross section, you'll note that it's a little bit larger than it's given credit for. Another one you'll need to know here, this is the vomer. The vomer is going to be the back parts of the nose. And you'll see that it's actually going to, again, extend pretty far backwards as well. Here we have the zygomatic bone right here for the cheekbone. Apologize. And then here, this again is the ethmoid bone. The ethmoid bone is going to have two different sides and then a perpendicular plate in the center region of the ethmoid bone. This is the mandible. The mandible is going to connect up into the jaw, right? So it is the jaw, and it has different processes. These are alveolar processes of the mandible, and those are going to be associated with teeth. There's also foramens, the mental foramen here, and that's all going to be, again, allowing for things like blood vessels and nerves to come through. Here's the upper part. This is your maxilla, so this is the part that's going to be above your teeth, right? And then I think that's about what we're going to be able to see from this direction. So let's go ahead and switch directionality. All right, so now we're looking at a lateral view. So we're looking at you from the side. We're going to see all the same bones, right? The frontal bone shown in blue, parietal bone shown in pink. The coronal suture is going to connect the two of them. Then we have the temporal bone. The temporal bone has some specific markings as well, including the temporal squama, that's here, and this particular lamboid structure, which is actually where the mandible is going to articulate in. So the mandible is going to have a little region here that's going to articulate in the mandibular fossa. It's going to articulate in directly with the temporal bone. Temporal bone also has these auditory meatus. This is where your ears are going to be bringing in information in the form of sound waves. And then we have a specialized process here called the mastoid process, which is going to be a projection. I'm sorry, here. This is the projection that is going to be at the back, basically at the bottom part of the ear, like right behind where the ear would connect. We also have a special styloid process, which is protruding here, and a condyle, which is connected to the occipital bone. The occipital bone here is shown here in orange. All right, so in the occipital bone, we have external occipital protuberance, that's towards the back we talked about, and that's going to be connected, the occipital bone is going to be connected to the parietal bone here by the lamboid suture. All right, so let's move forward. Here we have our sphenoid bone here, shown in green. The zygomatic bone shown in a darker orange, ethmoid bone in a lighter orange, and then the lacrimal bone, again, this is going to be associated lacrimal ducts or your tear ducts. This is going to be the region that's associated with the inner part of your eye. And then here's your nasal bone. Behind that will be your vomer that you can't see right here. Again, the maxilla and the mandible. All right, let's go ahead and take that same angle, but take a sagittal plane. So now we are inside the skull, looking towards the outside. We're going to see again the same markings or the same bones, right? So here's the parietal bone connected to the frontal bone by the coronal suture. You're going to hear me say that over and over just to kind of orient you. Then the parietal bone also connects in the back here to the occipital bone, shown in dark orange. The temporal bone, now this would be the temporal bone on the opposite side. We've removed the temporal bone that you would be looking directly towards, and then that would connect, they would have an external auditory meatus, etc. Here's a styloid process that protrudes down, so that's on both sides, obviously. And then this is what I was talking about the sphenoid bone. So the sphenoid bone actually, it looks like it's just kind of tiny if you're looking through the nose, but if you look at it from the inside of the skull, you can see it actually protrudes quite extensively, and it has a lot of different pockets. Right? These are going to be your sinus cavities, and we'll talk about the sinus in a little bit. We have several different types of sinuses. We have the ethmoid sinus, the sphenoid sinus, etc. But they're basically just little pockets of cavities that can catch mucus or air, etc. And they can also, they're prone to infection. So if you end up with a sinus infection, it could be in any of those different regions. But I digress. All right, so this here, again, this is the frontal bone. The frontal bone is going to connect down to the nasal bone, and that's all going to connect into the ethmoid bone. All right, inside this ethmoid bone, we have crista galli. There are going to be little regions that kind of protrude upward. There's the cribiform plate, which is going to become very important when we talk about olfaction, which is the sense of smell. So there's the cribiform plate. There's also a perpendicular plate, all found there in that ethmoid bone here, perpendicular plate and the cribiform plates. All right, again, these are the sphenoid sinuses. We talked about that. Here's the inferior nasal concha, which is going to be inferior, right, to the nasal bone. And then the maxilla. And then this here is at the very end of the maxilla, there's a palatine bone. The palatine bone is going to be the top of the palate. You have the hard palate and the soft palate. The hard palate here is the palatine bone. All right, and then the mandible, and then we have a free-floating bone here called the hyoid bone, which is found in the throat. We'll talk about that in just a moment. All right, so if we're looking at the posterior inferior view of the skull, this is basically going to be showing you the back of your head. So here's the sagittal suture, which is going to connect the two parietal bones. The parietal bones are connected to the occipital bone. As I mentioned previously, we have a sutural bones here, which are going to fill in any regions that haven't quite closed properly by the sutures. And then this suture here is the lambdoid suture, which is going to connect the parietal bones to the occipital bone. Right? We have the temporal bone here. The temporal bone is going to be connected also to the occipital bone by that lambdoid suture. So that lambdoid suture runs all the way down and across. So lambdoid suture actually touches a lot of different junctions. It touches the junction of the parietal bones of the occipital bone, touches the junction of the occipital bone with the sutural bones, and the occipital bone with the temporal bones as well. All right. These are the external occipital protuberances. This is if you feel the very back of your head. This is the region where your head starts to feel like you have a little ridge. And then we have the nuchal line. If you follow that down, you have a vertical line at the back of your skull. And that's going to go down to the foramen magnum. And this is going to be where our spinal column is going to connect. It's going to allow continuation of the spinal column and the spinal fluid and the spinal cord all the way up into the brain. This is the vomer from the back. Again, the vomer is going to separate the left and right side of your nasal passages. And then this is your hard palate, which has, again, the palatine bone and the palatine process there of the maxilla. And then here's the mandible. All right. Okay, so these are again the exact same bones, but now we are looking from a different view. So now we're looking from the inferior view. Basically, we are looking up as though we are the top of the spinal column. All right, so this is the foramen magnum. You can see how large it is from this direction. We've also removed the jawbone for ease here. All right, so here's our teeth and our maxilla. The maxilla has a specific region called the incisive foramen, incisive being that's near the incisors, and that's right in the palatine process or the hard palate or the palatine bone, right? The palatine bone here is back here, I apologize. And that's going to lead directly into the inferior nasal concha. Those are here. Additionally, we're looking here at the vomer. The vomer is going to, again, be the one that separates the left and the right side of the nasal cavity. Here we're looking at the sphenoid bone, shown in green. Here we have specialized foramen. Here's the foramen ovale and the foramen spinosum. All right, so now let's look here at the temporal bone. The temporal bone is shown in purple. It also has several processes that I want to point out. The first is the mandibular fossa. This is where the mandible, which again, the jaw has been removed, so the mandible's out of the way. But the fossa is going to be where it articulates with the mandible. Here's the carotid foramen. This is where the carotid artery is going to run. Here's the jugular vein, going to run right alongside each other. You're going to have that on both sides, right, here and there as well. Here's the occipital condyle, which is going to be where our vertebrae are going to articulate here with the skull. All right, what else did I miss? Here's another foramen, the mastoid foramen here, which is found in the temporal bone. We also have the external auditory meatus. Again, that's going to connect to your ear and going to allow for sound waves to travel in through the ear canal. Here's the styloid mastoid foramen. Come on, here you go, styloid mastoid foramen here, and the styloid process as well. All right, I think I've touched on everything from that direction. All right, so now we are looking from the top of the skull into the skull, having removed the top. So we're looking at a transverse plane down into so it's a superior view, into the cranium. Again, shown in blue, frontal bone. Frontal bone here is connected directly to, this is the ethmoid bone, and there are specific regions of the ethmoid bone that I want to draw your attention to. This is the crista galli. Then we have the olfactory foramina, which would be a small foramen for the olfactory vessels and nerves. And then this is the cribiform plate right here. Okay, and the cribiform plate, again, that will become important when we talk about olfaction or the sense of smell. All right, here's the sphenoid bone. Again, it's shown in green. In this case, we're not seeing all of the sinuses because we haven't protruded far enough downward to be able to see where the sinuses would be located. I apologize for that. Then this here is the lesser wing of the sphenoid bone. This is the greater wing of the sphenoid bone. So if you were to picture these kind of looking like a butterfly, which is what they kind of named it after, we have the greater and the lesser wing. And then here we have the tuberculum selae, the hydrophyseal fossa, and the dorsum selae. And those are all part of what's called the sella turcica. All right, additionally, while we're talking about the sphenoid bone, here we have the foramen ovale, and the foramen spinosum. And then the foramen lacerum is going to be a foramen that's between the sphenoid bone and the temporal bone, which is shown here in purple. Okay, in the temporal bone, we have the petrous portion. That's this part here. We have the internal auditory meatus, which is going to connect to the external auditory meatus. And then we have the jugular foramen. Again, a foramen as a whole. I apologize. The jugular foramen is right next to the temporal bone, but just to be clear, that's actually going to be in the occipital bone. And we have the jugular foramen right here, and that's going to be on both sides. And then the foramen magnum, which is the largest foramen in the body, which again is where the skull is going to connect to the spinal cord. All right. So we had the mandible removed for the last set of slides. Let's talk about the mandible for a second. That's your lower jawbone. It is the strongest of your facial bones, and it is the only movable skull bone if you exclude the inner ear bones. Again, those are called the auditory ossicles. We have 3 in both ears, so 6 total, and we'll talk about them separately. So this is the mandible. Here's that condylar process that we talked about. So a condyle is just going to be a region that's going to be, again, smooth and has like a little ball, basically. Here's a mandibular notch right there. And then this part here is called the ramus. We follow down, this part is called the body, and then this has a little angle, so called angle. There's a foramen, that's again where we're going to have things like blood vessels and nerves flow into this region and feed to the teeth, for example. There's the alveolar process. So that's going to be another region where it's going to connect basically to your teeth. There's several of these alveolar processes. It's basically where the jaw is going to come up and form the tooth sockets. Here's another process, is the coronoid process. And if you look from the inside, we have the mandibular foramen right here. Again, foramen as a whole, and that's going to allow for passage of blood vessels and nerves. So we have 2 major foramen in the mandible, the mental foramen and the mandibular foramen. All right, so I told you we were going to talk about sinuses, so here we are. The paranasal sinuses, and anyone who's ever had a sinus infection knows that they are not all created equal. Right? You can have sinus infections in different regions of your sinuses, right? These are mucous membranes, these are cavities, and they're found in the frontal bones, the maxillary bones, the sphenoid bones, and the ethmoid bones. So there's 4 different sets of bones that have these cavities. And the purpose is that they're used as resonating chambers, so the voice can actually be enhanced. And you can note that when you speak, you can actually kind of feel it bounce around in the sinus cavity. And also that is why when you get sick, you end up with an odd voice, because it changes the way that things echo inside that region if you end up all filled with, for example, phlegm and mucus, right? And so that region is meant to increase the surface area of the nasal mucosa, and it also has the ability to help keep it moist as well. So where are the paranasal sinuses? Good question. All right, so these are the maxillary sinuses, and these are going to be the ones that are found at the top part of your teeth, basically. They're found at the intersection of your teeth and your cheekbones. On top of that, we have the frontal sinus at the top, and then we also have the sphenoid sinus, which is shown in green, and the ethmoid sinus, which is shown here in like pink. Again, sphenoid sinus, which is a little bit further back, so this looks like it's overlapping if you're looking at it from the front view, but if you look at it from the side view, you can see they're actually 3-dimensionally separate. So here's the sphenoidal sinus, and the ethmoidal sinus, frontal sinus, and the maxillary sinus. So 4 different sinus cavities. All right, so this is showing you an infant skull, basically, or a skull that is still forming. So we're going to have some soft spots, and soft spots are known as fontanelles. Soft spots and fontanelles are basically regions that are in between the cranial bones that are filled with mesenchyme but aren't hardened yet. They close up starting at about 6 months of age, and the later fontanelles close up at around the 2-year mark. So this major soft spot that you think of, that's called the anterior fontanelle, that's found directly on the top of the baby's head. And that's going to be where the coronal suture is still suturing together the frontal bone and the parietal bone. So they're going to end up forming the frontal coronal suture. And then this here is the anterior lateral fontanelle, which is going to be between the parietal bone and the frontal bone, and the sphenoid bone here and the temporal bone here. And the posterior fontanelle is between the parietal bone and the temporal bone. And the posterior lateral fontanelle is going to run here into the posterior fontanelle there, and that is going to be connecting the regions of the temporal bone with the parietal bone with the occipital bone. All right, so basically anytime you see that the bones haven't quite fused yet into our sutures, you're going to have fontanelles, and the fontanelles are going to be in different regions. We have multiple different soft spots, if you will, or fontanelles, in a developing infant, and again, they're going to close up approximately 2 years of age. All right, so the hyoid bone is a specialized bone that supports the tongue, and it attaches directly to the muscles. And it's situated directly here at the top of the larynx, right there. So it's beneath the jaw and at the top of the larynx. And it has specialized regions. It has a greater horn and a lesser horn. So each of them have two horns on both sides. And then it also has the body itself. So the greater horn is much larger, and the lesser horn, and then the body. And the body protrudes forward, and the greater horn goes back towards the throat. All right, so we're going to travel down now from the skull to the vertebral column. The vertebral column, you may also know of it as the spinal column or the backbone or the spine. It has 26 different vertebrae, and it's divided into 5 major regions. The lower regions include the sacrum, that's here. It's made up of, sorry, it's here. The sacrum is made up of 5 bones that have fused together. So younger children don't have that fusion, but teenage onward, you're going to have a fused sacrum. Um, and then the coccyx, which is also made of 4 fused vertebrae. Again, originally this is your tailbone, if you will. Someone has broken your tailbone, has broken the coccyx. This region here has 4 different bones originally, and then they're going to fuse together as you get older. The rest of the individual bones, there's 24 other individual bones here, right? And that's going to be the spinal column. And the purpose of the spinal column is to protect the spinal cord. So we have so if you're looking anterior and posterior, so this would be the back, this would be the front, right? This is the cervical curve. So these are the 7 cervical vertebrae. Then we have 12 thoracic vertebrae. Then we have 5 lumbar vertebrae. Then we have the sacrum and the coccyx. So you'll note these as C1 through 7. This will be T1 through 12 and L1 through 5. So the lower back would be that lumbar curve. And then again, sacrum would be originally S1 through 5 and coccyx 1 through 4. But as you end up becoming an adult, you end up with those bones fusing together into one solid sacrum and tailbone or coccyx. All right, so what separates the vertebrae apart? We have these intervertebral discs. You may have heard of someone who has a slipped disc, and we'll talk about disorders of the spinal column in just a second. But the intervertebral discs basically keep the vertebrae separate, and they're located between the bodies of each of the vertebrae, starting from the second cervical vertebrae down to the sacrum. They have an outer ring of cartilage. It's called fibrocartilage annulus fibrosus, which surrounds an inner pulpy nucleus or nucleus pulposus. And the top and the bottom of each disc have a specialty layer of hyaline cartilage. And the purpose of the intervertebral discs is to help absorb shock and also create spaces between the vertebrae so they don't rub upon one another. And that looks kind of like this. So if each one of these are one vertebrae, this here in yellow is a spinal cord. It's running all the way through. You can see now how each of the spiny processes that reach outward, right? Spinous processes are all going to kind of overlap with one another in the purpose of protecting the spinal cord itself, right? We also have these transverse arches that come out. So each of the vertebrae are going to have a transverse arch, and then the vertebral arch, and then the spinous process that are going to come out in addition to the vertebral body. But in between the vertebral body, we're going to have these intervertebral discs, right? And every time that we have these little regions between them, we're going to have spinal nerves and blood flow that are going to be protruding out. We also have these specialty regions. These are little facets, and this is where the ribs are going to articulate. So if you picture that a rib would sit right in there, and that would, then we're only going to have these for the upper region, right? As soon as we get out of the region where we would have a rib cage, we'll no longer have these little facets. All right, so a typical vertebra, again, it has several different regions, but the vertebrae from each region have different delineating structures. They have common structures for themselves that are going to be separate from the other regions. And that'll help you identify which type of vertebrae they are. And also the first 2 vertebrae are critically different from the others in shape and function. And that's because we have a series of nerves that are going to be coming out through the first set through C1 and C2. After that, because the nerves have left, we won't need these particular regions. So this transverse foramen is going to get smaller from C1 to C2 and then disappear. Actually kind of disappear already into C2, but you can see it there, transverse foramen's getting smaller, and then disappear from that point forward because the nerves have actually already entered into the body from that point. Those are called cranial nerves, and we'll get to that when we talk about the nervous system. But let's talk about vertebrae. All right, so this is one vertebrae. This is C1. Here's the posterior arch and the anterior arch. In addition, we're going to have articular facets here, which are where we're going to articulate with the vertebrae above and below. This is going to be a groove for the vertebral artery and for the cervical spinal nerve, and every single one are going to have nerves and arteries that are going to be leaving out through these regions. Now this, let's see. but the cervical nerves, I apologize, this those nerves are special that are only going to be coming out of C1 and C2. Every single vertebrae in the spinal column will have a nervous supply, though, that are going to extend outward. And again, we'll talk about that when we get to the nervous system. But I digress. All right, we also have a region from the spinous process that digresses down. This is the lamina. And we also have the vertebral foramen. Again, this is a hole whereby we're going to have the spinal column pass, and it's going to get smaller and smaller as we travel downward because we're going to have loss of spinal nerves because we're going to protrude outward each of the different vertebrae. So by the time we get to the bottom, the spinal cord is going to get smaller than it is upwards towards the neck. All right, let's look at the thoracic vertebrae. So the thoracic vertebrae are responsible for supporting the ribs. And so they have specialty regions that are not found in the other regions. And those are basically going to be these specialized facets for the heads of the ribs, here and here and here, etc. So we're going to start with T1 heading to T1 through 8, and then 9, 10, 11, and 12 are a little bit more specialized because they're going to start to get a little bit larger because they're going to be supporting more weight. And then that's going to lead directly into the lumbar region. So we have differences in the spiny process, for example, that kind of protrude out. You can see how that changes as we move our way down. But if you look at each of the vertebrae themselves, they're still going to have some of the similar regions, including that spinous process as well as the vertebral body, right? In articular process, that's going to allow it to articulate with the spine, with the vertebrae above it, and then also these facets that are going to allow them to articulate with the tubercle of the rib. Again, here's a superior articular facet. This is going to articulate with the vertebrae above. Then the inferior articular facet is going to articulate with the one below. Here's the facet for the rib itself, the transverse process, the spinous process. This region is the superior vertebral notch. This is a demifacet or a smaller facet. We have a superior and an inferior demifacet. And then this here is the vertebral body. As we head down into the lumbar vertebrae, we're going to start noticing that they become very small. So although the foramen might get smaller, the vertebral body is going to get larger. They're supporting the body's weight, and they don't have any special structures that are specifically associated with them. So we're going to see basically all the same things that we saw elsewhere. The spinous process, the superior and inferior articular processes that are articulating with the vertebrae above and below them, the transverse process here, come on, transverse process, vertebral foramen, again, this is where we're going to have the spinal column and spinal cord run through. Pedicle here is going to connect the vertebral body to the spinous region, right? And if we look at a lateral view, we're going to see the same structures, but from a different angle. Here's our superior articular process, the transverse process, spinous process, the inferior articular facet where it's going to articulate with the vertebrae below. The articular process here is going to articulate again with the vertebrae above. Then we have the superior vertebral notch and the inferior vertebral notch. The pedicle, which again is going to connect the body to the spinous process region. All right, heading further down, we're going to reach the sacrum. The sacrum is triangular shape, and it is comprised of 5 vertebrae. They were originally 5 separate vertebrae, but around teenage years, between 16 and 18 years of age, they start to fuse together, and around 30 years, they become one solid bone. It's all part of the pelvic girdle, but the rest of the pelvic region is actually going to be part of the appendicular skeleton. The coccyx is going to be below the sacrum. It's also triangular in shape, but it's a more pointy, and it's comprised of 4 vertebrae that fuse together again between 20 and 30 years of age. So by the time you're 30 years old, your sacrum and your coccyx are one bone instead of being 5 and 4 respectively. All right, so what does that look like? So these are the sacral bones, 1, 2, 3, 4, and 5, or were when you were a child. As you are an adult, it becomes all one sacrum, and we have several different lines to pay attention to. So here's the transverse line. We also have foramen, which again is going to be allowing for the passage of blood vessels and nerves, etc. So then if we move forward, we have this sacral promontory, which is at the base of the sacrum, which is going to be where it's articulating. Here's the articular process articulating with L5. This region here is the sacral ala. It's like a ridge here on the outside. If we look at the posterior view, so you're looking at the anterior view, right? You're looking at it from the front, basically. So this is what's going to line the inside of your body. This part's going to reach outward towards your skin. Again, this is the coccyx on the bottom, coccyx 1, 2, 3, and 4, as we mentioned previously. They are originally, up until about 20 years of age, 4 separate bones. And then once you end up being a little bit older, from that point on, 30, etc., it's going to be a solid one single bone. This is why younger children, although they fall a lot more often than adults, they generally don't break their tailbone, because their tailbone is still 4 separate bones. So they slide around quite a lot and they don't have one solid piece that they can snap. But we as adults, we have to be careful if we fall, because we can break the coccyx very easily if we fall on our butts. All right, so this is looking at it from the posterior view, so we're looking at it from behind. Here's the sacral canal that runs down here. This is the superior articular fossa. Again, that's going to articulate with L5. Here's the sacral tuberosity, which is just a rougher region that's just going to be defined as not being super smooth. Here's our sacral crest, lateral sacral crest. We also have the medial sacral crest, which is a little bit more pronounced. And again, the posterior sacral foramen. So we have several sets of sacral foramen. Let's see. If we look down at this is the cornu, this region here. We have both the sacral cornu and a coxal cornu, so they're going to articulate right there. And then that's going to lead us directly into the coccyx. So from the coccyx, we have specialty regions like the transverse process, etc. But generally, the coccyx is just going to be protruding down C1 through 4, just to be protecting the lower region of your spine. All right, so let's talk about how the rest of the bones in the chest are protected of the organs, or serve to protect the organs inside the breast cavity, and how they articulate with the rest of the spinal column. So the sternum is the breastbone, and if you've ever performed CPR, you know exactly where it is. It's basically going to be the line that connects in the middle of your rib cage. It's flat, and it's located right at the center of the anterior thoracic wall. It's divided into 3 different regions: the upper, middle, and the lower region. These are called the manubrium, the body, and the xiphoid process. And these guys usually fuse together by about 25 years of age. So you're starting to see a familiar trend, right? By the time you're just post-teenage, all of your bones that are supposed to fuse together have gotten to the point where they're fusing together. And the sternum goes all the way up to the clavicles, which are going to be your shoulder, go all the way up to, your collarbones, and the costal cartilages from the ribs. So here's the way the ribs are going to connect. This is the sternum itself. The sternum, again, it has 3 different regions. The upper region is the manubrium. The middle region is the body, and the bottom is the xiphoid process. So the xiphoid process is actually, if you follow your rib cage up, and you can feel right in the middle, there's a little kind of dangly part. That's the xiphoid process. And that's actually going to connect out to the rib cage in several different ways. All right, so again, here's the manubrium, the body, and the xiphoid process. It goes all the way up to the clavicle. Again, that's your collarbone. This is the clavicular notch right here, which is where it's going to interarticulate with the sternum. If you see here, the back is going to be the scapula, so we're looking all the way through, but we are looking from the front. All right, so we also have this cartilage. These are called costal cartilages, and the costal cartilages is going to connect the rib bones to the sternum. So this gives us a little bit of flexibility, because cartilage is going to be a little bit more flexible than bone. And again, our rib bones are 1, 2, 3, 4, 5, 6, 7, 8, and 9. We're separated out into true ribs and false ribs. True ribs are ribs that actually connect directly to the sternum, and false ribs are going to connect to each other before connecting to the sternum. All right, so the ribs are there to provide support, but they're also flexible, so it allows you to, for example, breathe, right? Moving your diaphragm and expanding your lungs. So we have 12 pairs of ribs. They start from the thoracic vertebrae and extend to the sternum. And the bony portion is generally going to end just before it reaches the sternum. So we have a region of hyaline cartilage that are the costal, which costal just means ribs. You see intercostal, it means between the ribs, right? So costal cartilage is rib cartilage, which attaches directly to the sternum. And again, the first 7 are called true ribs because their cartilage is connected directly, and the next 5 pairs are called false ribs because their cartilage is indirectly connected or not connected at all, right? So for 11 and 12, these ribs back here, the cartilage is not connected. For 10 through, I think it's 5, right? So yeah, 6 through 10, they're all going to be connected in one spot. So 1 through 5 are true ribs, 6 through 10 are false ribs. Actually, pairs 11 and 12 are false ribs as well, but they're just not even connected. All right. So this is the thoracic. I'm continuing on with the thoracic bones. This here is the a rib, right? It's a posterior view of a left rib. The rib's going to have a head region at the top and a neck region that supports that head, and 2 facets, the superior facet and the inferior facet. Again, that just means above and below, and that's where it's going to articulate into the vertebrae. right? As we travel around, we end up with an angle, the costal angle. This is as your rib cage moves. Then we have a costal groove inside that. So from the inside of the rib, if you were looking outward, you can see you have a nice little groove elongating here till we reach the rib body. And then we end up with another facet. This facet is where we're going to connect to the cartilage. So a facet for costal cartilage. All right, so here we go. We're connecting to the vertebrae here. This is the transverse process of the vertebrae, right? Here we have the head of the rib seen through the transverse process. So here, this is basically being shown as see-through. Here's a superior facet and the inferior facet connecting directly into the transverse process, articulating at the external part here, the facet for the tubercle of the rib, again, also connecting to the transverse process. So they connect to the spine in three different regions: the superior facet, the inferior facet, and the facet for the tubercle. And that's going to be on both sides. As we move all the way to the outside, it's also going to connect to the costal cartilage by this facet here for the costal cartilage, which then is going to connect in to the sternum. All right, so that's ribs. So let's talk about disorders that might go wrong. One of the things that we talked about previously was slipped disc or herniated disc. And if a herniated disc occurs, basically what happens is the pulp region pops out of, so that's here, the nucleus pulpus, pops out of that fiber region, the annulus fibrous region, and starts pressing on a nerve. Right? So a herniated disc means that every time that you move in a certain direction that would normally be would be comfortable, it now is uncomfortable because you're pressing on a spinal nerve every time that you move and grind. And again, here's showing the vertebrae. Here's a spinous process. Here's a spinal cord. And every time that every time that the vertebrae connect, there's a little region in between them whereby spinal nerves are coming out. So there's a spinal nerve coming out at every single vertebral connection. All right, we also have some issues that can occur if the spinal column curves become exaggerated. Things like scoliosis or kyphosis or lordosis. Anytime you see osis or leosis, or you're basically seeing that you're having a curvature in one direction or another. So scoliosis is lateral curvature, right, left or right. Kyphosis is thoracic curve, bend forward. And lordosis is the lumbar curve but bent backwards. So this is what scoliosis looks like. You're moving too far to the left or to the right. So instead of having a straight spinal column, you have a curved spinal column. It looks like this. Kyphosis is if you are leaning too far forward. This tends to happen in elderly people. You see that looks like their scapula and their shoulder are actually all in the same spot, even though they should be kind of above and below one another. And lordosis is basically if you have just too much curvature at the lower part of your spine here, the lumbar part, so you arch backwards constantly, basically. Another disorder of the spinal column is something called spina bifida. And spina bifida can happen if during, it's a congenital defect, so it happens during development, and it can happen if the lamina don't develop properly, and it can have various ranges of deformity. So we can have the minor deformity to very severe deformity. In the very severe deformity, you can sometimes end up with a cyst-like sac that contains the meninges, the cerebrospinal fluid, and the spinal cord, and the nerve roots, all of which are obviously supposed to be internal in the spinal column. And instead, they're protruding outward from the spinal column like this. So this is the entire spinal cord of this individual with meningeomyelin. And in first world countries, this is something that is typically able to be treated at birth and is also typically avoided by eating folic acid during pregnancy. So that's why they tell you to take your prenatal vitamins, because one of the major problems that can happen if you end up deficient on something like folic acid is spina bifida. So it is something that's more prevalent in third world nations than in first world nations because of prenatal health. All right, so thank you very much for sticking with me. I appreciate listening to Chapter 7.